Hey everyone, I'm just going to quickly show a little bit about two types of motion that are happening in the cervical spine during locomotion. This can be quite confusing, so I'm going to try to keep it brief and not cover everything, but just enough that we can start using this, okay? One of the things that happens is we often think about the upper joint moving in relation to the lower joint. But in locomotion, it's kind of the opposite. What's happening is we're swinging our legs forward. Obviously, our neck and our shoulders are moving as well. But what your body is trying to do is keep the head cruising along in a straight line rather than being bobbled all around like your pelvis is. So one of the functions of the spine is to iron out all that motion, all that flexion extension, all of that rotation and lateral flexion. It's all trying to be ironed out by these lower joints. By the time you get to the top, it's being relatively stable. And here we have C3, C4, just quite randomly in the cervical spine. But what I want to show you is that when we are taking a step forward, so say for instance, if we take a step forward and we're in a swing phase, so we're standing on the left leg, and we start to swing our right leg forward, what happens is the left shoulder comes forward. So your left shoulder is connected to the joints below this as well. So what's going to happen is your shoulders are going to come forward on the left like this. And then your spine is going to go into extension as you're pushing your leg forward. So our spine moves like this. In a controlled way, it's being moved under power to rotate like this, okay? So it's going into an extension and a rotation, okay? And that left shoulder is coming forward, okay? So our spine is like this. And so when we launch ourselves off from our left foot, our right foot's out in front, our left shoulder's forward, left arm's forward, and we're flying through the air and we're ready for our right leg to hit the ground. What's going to happen is you're going to get from this position, which we could call that left posterior, okay? Or left rotation, left lateral flexion, okay? You're going to go from this position, and what's going to happen is your spine, your heel's going to hit the ground, and the forces are going to be coming in an angle like this. So your right foot's out here, it's going to hit the ground, and your body's going to try to continue forward. So what's going to happen is your body is being braked. So you're pushing off with the left, so you're kind of pushing off this way, and your right foot's going to hit the ground, and that there's going to be a braking function. And that what that's going to do is exert a force coming in at an angle like that. So the lower joints will be forced posteriorly. So it's basically lower joints be forced to the posterior left. So it's going to have a shearing function like this in the spine. So again, when we push off, we're going to be like this, okay? Our spine's like that. And then as we have foot strike, there's going to be a shock, a fast force that's going to take the joint. See if I get some focus here. It's going to take the joint from this position, and boom, it's going to come into flexion, and it's going to kind of have a shearing function like that. Now, the cervicals can do this motion, okay? We can see that in the uncovertebral in the front, that I have these little gummy things in here to take up the space of the disc. So basically, it's going to have this function right here. So that's going to be going posterior into the left. So it's going to have a shunt, boom, like this. So in that function, what's going to happen is the joint is going to go through, boom, a neutral position, okay? It's going to go through a neutral position. Your foot is going to hit the ground. It's going to drive the joint to and through a neutral position. So you're going to go from a left posterior to sort of a left anterior, okay, as that joint comes back. So again, let me see it from the back here. We're going from this position, okay, to this position. So it's like a shunt this way, okay? So it goes like that. And again, we're going to go from here, boom, to a neutral position, and then carry on in that position. And then what's going to happen is you're going to stand on to your right foot, and then that whole function is going to reverse, and you're going to, through a controlled contraction, rotate the joint into a position which is exactly the opposite of where we were just a moment ago. So now we're ready to launch off with the other foot. Okay, so what's happening is we have a phase of powered rotation, and then we have a shunt, okay? And we have a powered rotation and then a shunt. So our spine is always being shunted like this, okay? And it's being shunted like that, okay? And these are the key issues where we can apply our, if it isn't doing that, I should say, those are the key points that we can try to resolve with our adjusting. So it's this type of subluxation, or there's an imbalance of these musculature around the joint, which will be holding the joint like this, okay? And that's what we feel. You can feel that statically, or you can feel it when you put the person in that position, that, yeah, the joint just doesn't move out of that position very well. So we might interpret this as being a lack of rotation in one vector or another vector. Okay, we might interpret this as a lateral flexion problem, but really what's happening is this is a resistance of the joint to come back to a neutral position. And it's that shunt that should be able to allow that to happen, but the body is not responding well to that very fast impulse of heel strike. But we can use the impulse, or high velocity, low amplitude adjustment, we can use the impulse of that to, boom, break through that specific tension to bring the joint back to a neutral position. So it only works, obviously, when it's very, very specific. But we have a tool for that. So this is what I'm arguing, is we need to find where these joints are stuck like this and just bring that joint back to a neutral position. Once you do that, then every other motion, all those rotational motions will be restored, and lateral flexion, all this glide is going to be working very, very well. You just have to take it from where it's stuck. It wants to shunt back this way, and it's not doing it. That's what you need to fix, okay? So generally, if the joint is stuck like that, what you can do is just take the person's head, let it drop forward. So I'll sort of try to show you, let your head drop forward, put your hands on the back of their neck, let the head go into a little bit of flexion, bend the head to the left, and then apply a force to try to see if you can straighten the joint back up. Okay, so it's basically like taking the joint from a rotated, a flexed position like this, and try to bring it back and glide it across. So you're just basically almost applying like a lateral force to try to see if you can get this joint to come back. If you feel resistance coming back to neutral, that's where you adjust. So I'm going to do some videos. I'll try to show a little bit more detail how this adjustment works. But what's really nice about the adjustment is if we imagine that the joint is stuck like this, okay, and it's not getting the shunt coming back like that, okay, really, again, what we're talking about is the lower joint not moving. So in the adjustment, what you're doing is you're holding this upper joint and you're taking a contact on this joint and basically just giving a shunt back that way, just boom, pushing back like this. It's very, very simple. And when you take, in the setup, what you're doing is you're taking that joint into rotation, okay? But this is a rotation it's already doing anyway. So you're just going into that kind of ease of motion. The joint is going to go that way easily. It's going to rotate. It's going to laterally flex. You have to use your fingers on the side of the neck to push up. And you'll feel it's just going to go up really easily there. So you're going to have lateral flexion. You're going to have rotation in the setup. But in the adjustment itself, you don't need to take any tissue tension out. You just put your finger here and just give your push, okay? And it just unlocks. So, you know, you get the person in the setup, and then when you adjust, it's just, you don't even have to push or move anything. The person doesn't even see it coming. You just hold it, and boom, just straight from contact. You just take contact and drive. It's as simple as that. It's super, super, super easy adjustment. So I'm going to try to show it in a video working on someone, but it's helpful, I think, to see how these joints are moving in and to understand those two phases of motion. This glide is very important, okay? And also the rotation. Now, the rotation is a controlled motion. There can be problems there as well, obviously, but I think there's a better way of doing it than the high velocity adjustment. But the high velocity is just a direct line of drive. We're getting that glide and doing it within the vector of that motion of how the spine is, the lower part of the spine is moving in relation to the upper part of the spine. So the vector is going to be like this, the vector is going to be like that, and then we clear it very, very easily. So I'll do more on that in future videos. I hope that's helpful to you guys. Thanks for tuning in. If you have any questions, just shout them out to me, and I'll be glad to address those. Again, thanks for watching.